Thank you, Madam Chair. I appreciate that. If I might take a brief moment of personal privilege and just say that all of us in Virginia are mourning the passing of former Senator John Warner, who served Virginia ably and was a very nice man. And so we're mourning his passing overnight. That being said, I do appreciate you holding this hearing on building COVID-19 vaccine confidence. I also want to thank the witnesses for taking the time to join us today, especially Dr. Karen Shelton, who is from the 9th District of Virginia and doing some great work to serve all of the people of southwestern Virginia. We have come a long way since the first confirmed case of COVID, SARS-CoV-2, which causes COVID, and that was diagnosed in January of 2020. Today we have 3 safe and effective vaccines with enough supply for every American age 12 and up who wants one. So far, over 61% of the U.S. population have received at least 1 dose. While we are well on our way to returning to normalcy, we still have to work to reach the higher rates of vaccinations necessary to eliminate the virus's significant threat to our public health. At the beginning of the national vaccination campaign, demand exceeded supply. Now the U.S. faces the opposite problem. The vaccine supply is plentiful and exceeds the number of people in line to be vaccinated. The current unvaccinated population varies in its demographics, intentions, and concerns about the COVID-19 vaccines. There are about 13% of individuals who say they will definitely not receive the COVID-19 vaccine. Yet there is a slightly larger share of individuals, 15%, who are waiting to see how the COVID-19 vaccine is working on other people before they receive their shot. These individuals could be persuaded to get COVID-19 vaccines by receiving answers to their questions and concerns. The leading concerns that contribute to vaccine hesitancy are that COVID-19 vaccines are not safe as they are said to be, and that individuals will experience side effects following vaccination. Individuals are also concerned about what is actually misinformation about infertility and other possible long-term effects from getting the COVID-19 vaccines. Trusted messengers need to meet these Americans where they are, by listening to their concerns and asking permission to share accurate information to help them reach the right decision for each individual while reinforcing their safety, dignity, choice, and autonomy. My home district is a region of rural communities. The Centers for Disease Control and Prevention released a study last week that people in rural areas are receiving the COVID-19 vaccines at a lower rate than those in urban areas. My district is actually doing fairly well. But this study demonstrates a need to identify the barriers in many rural communities and to find solutions to remove them. Additionally, I have heard from my district on reasons why there are lower rates of vaccination. 2 common factors contributing to the lower rates are a lack of information on the technology of the COVID-19 vaccines, as well as a lack of access to receive the vaccine. The good part about these barriers is that they can be removed. We can provide accurate information on the decades of development for the mRNA technology in 2 of the vaccines, and that there were no cuts in safety requirements, just cuts in red tape. We can find innovative ways to bring vaccines to the people through mobile vaccination clinics. Public health practitioners should continue collaborating with healthcare providers, pharmacies, employers, faith leaders, and other community partners to identify and address barriers to COVID-19 vaccination in rural areas and other communities. Another key group of individuals who benefit from receiving the vaccine are children. Yes, COVID-19 is usually milder in children as compared to adults, but some children can get very sick and suffer complications from COVID-19. It is crucial to target messaging and provide accurate information and resources to this population so parents can make the best decisions for their children. According to the CDC, more than 500,000 children between ages 12 and 15 received a Pfizer vaccine just 1 week after it was approved for this age group. This is a great accomplishment, and I hope we can continue to work with advocacy groups to provide parents with the necessary information to make this decision so they are confident in getting their children vaccinated. I look forward to hearing from our witnesses today on what messages and strategies work best to remove barriers to a much higher level of COVID-19 vaccination throughout the United States so that we can all return to normalcy. Thank you, Madam Chair, and I yield back.